Maria, thank you so much for joining me on this call. We are here for Dignity Connects, and For Her Dignity has worked with BCW for many, many years now. Our start was back in 2016 with a gigantic menstrual festival in the community. Can you tell me a little bit more about how BCW works in terms of community-led ownership of programs, of approaches?
Thank you, Rachel. Brighter Communities worldwide model of community development is based in the community. It's needs-based, it's ground-up development. This is not top-down development. So across all our programs, the ownership of the projects belongs to the community. So we facilitate the process of gathering their needs. We facilitate communities to come together to discuss their needs and to prioritize them. Because it is from within the community that change happens. It isn't from us coming from overseas or from an NGO coming in. It is from within the community that change happens. So our programs, and we can talk about menstrual health, came from the community itself. We cannot do enough sessions. The demand is massive. And I think it just has grown from there, from community to community. When COVID hit, right? So here we are, we have the school program, which is called Girls for Girls, and we have the community program, and which is all about, it's the Swahili name for believe in yourself, because it's not just about menstruation, it's about self-esteem, it's about confidence, it's about, gender equality, essentially, right? So along came COVID in March, to cut a long story short, and we were like, oh my goodness, how are we going to do this, The demand skyrocketed. So we designed these packs, the ambassador packs, which are basically a number of sheets of A4 laminated information on the reproductive system, on the different kits, on the puberty between a man and a woman or a boy and a girl. Different things are in them, okay? And we said, let's train the ambassadors in small groups, and then they can go out to the community. So the ambassadors were each given a kit with information on menstruation, all the teaching tools, then a series of leaflets to leave with the girls in the community and boys. And there was men and women ambassadors as well, which is very interesting. And so everything was translated into Swahili as well as English. And then we gave them each 10 starter kits. So then we got to the kits, and we had brought needles and threads and old t-shirts and a load of scissors, and we said, how can we do this? And suddenly it took off. The people to make them are the women,
yes,
in the community. And it took off, and they clapped and sang. So since that day that we started, in total, there has been 2,214 girls sensitized,
wow.
1,660 women. Ambassadors, I think we have well over 300 at this point. We consider most of the women who have been sensitized will become ambassadors, right? Then we went to Kennegoot, which is a place at the far side of Kericho. And there was a group there of community health volunteers who were very interested. There was something different about them, right? So they were organized, and they said, we want to make these, the need here is thousands. It's not hundreds, it's not 10 or 20, it's thousands. So we went back out to them in the following week and helped them to come up with a business plan, right? So to figure out how to make a profit from this so that they could buy more material to make more pads. And we said, this is the group for us. We bought them the sewing machine. They picked all the materials they wanted, and we said, we will buy enough material for you to make kits for 300 girls to start off with. And we worked out that they would make enough money from them to continue. I think we invested probably close to $1,000 in them. And now they're off.
And they're using all of your health ambassador laminated sheets and the education part as kind of part of their marketing or health promotion for
Oh yeah. So like there's no kit without education. They're going out sensitizing in the communities. They've a stand where they can educate. So they have their posters up, and they're not giving the pads without the information. And once one does it and are successful, others will follow. And I would honestly say if we pulled out tomorrow, they will continue because they know the information. They have their kits, they're heading out. And even if we didn't give them the starter kits, which I think would be a bit of an extreme right now, but at least have the concept, right? Some girls said to me, yeah, I used 2 or 3 t-shirts that I have.
Actually, a t-shirt, there's a lot of them that can be used. And so having that fabric that's usable, that's suitable, and all they need is just the pattern. All they need is just the know-how, and they're off and running, like you said.
Yeah, and to understand the concept that you can make as many of these pads as you want.
Yeah.
It's up to you, to determine what your need is. It's not determined by the number of pads in a packet. And you can be clean and dry and, confident every day of your menses, you know what I mean?
Yeah.
And this is a very important point that, teenage pregnancies are on the rise here. And one of the reasons is transactional sex. Girls are sent out to fend for their families, but it's really desperate now. And we went to the girls and said, how are you getting on outside of school? And of course, it's a terrible tragedy here. They're in the fields all day. They're vulnerable, they're hungry, they're open to abuse. The story of schools being closed in Kenya and across the world is really horrendous. Yeah. And one girl started to cry. And so I said, look, I'm really sorry. And she said, well, I didn't know that it was my period when it happened. Oh. And she was like 10 and nobody told her. And of course, another girl who was kind of the leader of the group, she's about 13. She said, and without our teachers, we have no one to go to. They don't go to their mothers. You know what I mean? It's taboo to talk to your daughter in this rural part, right? So they go to the teachers and she had no one to go to and she didn't know what happened to her. And this is what's happening, right? So then they confide in, the boda driver or the local village, whatever. And suddenly, they're abused. And we have girls in these mountains as young as 9 who are expecting because of COVID. And that is not exaggerated. And you don't need any statistician. You can just walk. And when I go walking at a weekend, we walk for miles and miles. And you can see in the houses, you can see young girls, very young, with bumps, 11, 12, 13, and it's horrendous. And to me, this is why the men, like our donor funded part of the Menstrual Health project is going to surpass all targets because we poured COVID emergency money into it because it's so important. It's so important, and it's the trigger for so many things,
The stories are so powerful, and the need is real. And in terms of for donors in a Western country, what's the best way that they can help you? I get asked so many times, well, can we sew reusables and send it to you? As a donor, if I'm in Canada, what's the best way that I can help you?
It's a fair question, and we get asked it all the time as well, okay? And quite honestly, money is the best thing, no matter how small or big, because then we can get the local available materials here. Obviously we have the dignity kits that from yourselves, but I'm not being difficult. It is just very challenging to get things into Kenya. Each time you pay the shipping cost, then you have the customs. So we got 1,095 masks donated, and it cost us almost 2,000 euros to get them in through customs.
You could have made cloth masks. You could have made a gazillion cloth masks.
Well, this is the issue, right? And
I think sometimes as donors, we want to help more than, well, I don't want to just send my money, but in terms of sending your money does so many things. It allows us to be so much more cost effective. It allows us to actually create jobs at a local level in terms of like that team of people that you gave those 300 kits and they're on their way. It creates things. And so I think as donors.
Absolutely. I think we're all the same. We want to give what we have and we want to do something useful. But to me, the most economical thing and the best way, because as you say, you're not just supporting the purchase of the kit, you're also supporting the women to be empowered to raise more money, to get the markets to keep moving. There's tons of reasons why you would do it that way.
I shared with you a few of our illustrations, a few of our artwork, and it was amazing to see how your women took our artwork and they made it their own. They made your flyers of, like, make your own, like, it was their own marketing scheme, their own colors that they would put with it. And that was really exciting for me to see that, some of the stuff that we developed, it's not cut and paste. It's like, it's cooperative, give and let's see where they take it, and modified it and made it culturally even more appropriate than I could have ever dreamed possible.
People talk about education resources and this and that, and they talk about big money, but you don't need huge money. You just need, once you're happy with your set of laminates, you just reproduce them.
Do you find in all of the education that you've used and developed, like, I see so many organizations, they literally have these thick textbooks, and when I flip through them, they're just all words. And it's like, in these rural communities and in these different tribes, you have maybe multiple languages or dialects. How important is more picture based, like so that the kind of the more clear and simple the picture, so that even someone who doesn't have a lot of schooling can learn and teach others?
Pictures are the way to go. In our, let's say, our maternal health program, we have a flip book which the community health volunteer uses in a community. So goes and brings the community small groups, and it's just a series of pictures showing a woman going for ANC, a woman going to the health clinic, different things, right? But it's all pictures, because here where we work is multi-tribal, right? There is no way we can get everything translated, and a picture tells 1,000 words. But when you're in the community, pictures, basic, that's what you need. Because you don't want to put a woman off, particularly the women, right?
Yeah.
Some of them they haven't finished school. They haven't even gone to school, some of them that we're working with.
Right.
You don't want to feel excluded. You know what I mean?
Exactly.
So if they come, and this is all technical and whatever, they're not going to come back. To me, like for COVID, it really has come out strong. Like our strongest asset isn't what's in the bank account. It's actually our community network. And that's why I argue that, people look at organizations and they look at their size. What's the first thing they do? They look at the balance sheet. Okay. Yeah. And I say to this, why don't you look at our impact? And why don't you look at our value for money? Because if we added up all the hours that all those ambassadors, and remember, the ambassadors don't get paid a penny. And that's the argument for localization. It's the argument for working in partnerships. And it's the argument for having organizations in the country. So Brighter Communities Worldwide has an organization in Kenya and an organization in Ireland. In Ireland, we have 1 full-time staff, 2 part-time. In Kenya, we've 35 staff. I think that speaks volumes. You know what I mean?
That's amazing. That's amazing.
Yeah.
That is the power of partnership. And that is exactly why For Her Dignity has chosen to work with you, because why reinvent the wheel? You have invested years of that community buy-in and of that community respect and value. And like you said, your greatest asset is the people themselves. And again, that's how we started this whole talk, was about ownership, about community ownership, about lasting impact, which comes not because of you or me, even though we are very forces to be reckoned with, Maria, come on, admit it. But even us, we are nothing would stand a chance against the power of that community ownership. And unless it's needed and wanted and desired by that community, there's no real lasting impact. It's just a photo shoot. And we're not about photo shoots. We are about true lasting community impact. And we couldn't be more thrilled to work alongside you. And we are very honored as For Her Dignity to fundraise and to provide as many dignity kits as we can, because you have the team. And that's why I say to our Canadian champions going, the best thing that we can do is raise money for dignity kits, because they have all of the other elements there. And even those dignity kits now, it's kind of like seed corn. It's not even that's going to feed the masses. It's the seed corn that plants the field that then allows the harvest to be sown. As we've already seen in COVID, that them taking the kits and making them starter kits and adding to them, it's giving the community the permission of going, you're not limited by the amount of towels I have in a full dignity kit. You can have more than that. You can make as many as you want. And thank you so much for everything that you are doing, Maria. Honestly, my hat is off to you. It is a pure honor to work arm in arm with you.
We are just very grateful that we have found a partner like For Her Dignity who will work with us, who, value what we do in the community and who believe in this sense of, community-led development.
It's about sustainability. It's about community collaboration. I think even for donors, knowing that their every dollar counts, it goes so far because of the ripple effect when you do community-led development versus just coming on, with your agendas and smoking guns. Thank you again.